Have you ever experienced injury to any part of your body? What happens next? That part starts bleeding. So the bleeding continues for next few seconds or maybe few minutes. After that, bleeding stops spontaneously. Why the bleeding stops spontaneously? There is a physiological mechanism in human blood, in human body, which is known as hemostasis. So because of which the bleeding stops spontaneously because of the formation of a clot at the point of the injury that seals the injured area. This is a physiological mechanism which is beneficial for humans. It is good for humans and it is known as hemostasis. Now, have you ever imagined what happens if such a clot formed in the blood vessel in uninjured area? If there is no injury to the blood vessel, still such clot is formed. Is it physiological in that case? No, it is not physiological in that case. In that case, it is a disease, it is a pathology and it is known as thrombosis. So in this session, I will be discussing hemostasis and thrombosis. Let's start hemostasis first. So as I have told you, hemostasis is a physiological process in which what happens? Bleeding stopped spontaneously after the injury. It protects the integrity of the vascular system. That is known as hemostasis. It is made up of two terms. Hemo means blood, bleeding, and stasis means stoppage. So basically it is stoppage of the bleeding, hemostasis. So there are 4 steps in hemostasis. First I will be discussing hemostasis. After that I will start thrombosis. So before understanding hemostasis, you cannot understand the mechanism, the pathogenesis of thrombosis. So in hemostasis there are 4 steps. As soon as the person have injury, the person have a cut or an injury, so arteriolar vasoconstriction take place. So the first step is the vasoconstriction. In this diagram you can see this is the blood vessel, this is the endothelial lining of the blood vessel which is continuous everywhere. Here you can notice the disruption. So here it is discontinuous, so this is the site of the injury. So this is the site of the injury because endothelium is disrupted. This is the site of the injury. At this site, if you can appreciate the vasoconstriction, so focally this portion undergo vasoconstriction. Why vasoconstriction is occurring? Because less blood will enter in this area and less chances of bleeding. But it is only transient. It occurs immediately and it is only transient. Bleeding would resume if the activation of platelet and coagulation factors for the formation of primary and secondary clot do not take place. So bleeding will resume. So the first step is the vasoconstriction. After vasoconstriction, the second step is primary clot formation or primary hemostasis. Primary clot is made up of platelet and the secondary clot, which I will teach you after this, that is made up of clotting factors. So 2 clots will be formed. First primary, and the primary is very unstable. To stabilize primary clot, we convert the primary clot into secondary clot, and secondary clot is stabilized by coagulation factor, clotting factors. So let's talk about the primary clot first. Primary clot is the platelet clot. It is made up of platelet. So what are the steps? You can understand the steps like this. So initially there is injury. Just because of injury, platelet will get activated. So 3 things will happen one by one in a sequence. First, platelet adhesion, then platelet activation, and then platelet aggregation. The 3 terminologies are very confusing, so it's very important to understand the differences between them. You can understand in this diagram there is a row of platelet. As soon as this area is having injury, this is the site of the injury. In this area you can see the endothelium is disrupted. So there is direct subendothelium. There is no endothelial lining. It is already disrupted because of the injury. We can see the subendothelial lining. Now in the lumen of the blood we have RBC, we have WBC, we have platelet. So platelet will get activated here. Here the platelet will get activated. The first thing will happen is platelet adhesion. In platelet adhesion, these rows of platelet, can you appreciate the platelets? The platelets will come and they form a bond with the subendothelial tissue. This step is known as platelet adhesion. This step is known as platelet adhesion. So that is formation of bond between the platelet and the subendothelial tissue. So a first row of the platelet is formed. Now these platelet will secrete, can you see? This is the endothelial lining. In this diagram also you appreciate, this is the lining of the blood vessel, this is endothelium. Here the endothelium is disrupted. So in this diagram, this is the site of the injury. Only this portion is the site of the injury. You can appreciate these are the platelet. So this platelet is showing adhesion. Adhesion means it is forming the bond directly with subendothelial tissue. So adhesion is the formation of the bond with the subendothelial tissue, that is platelet adhesion. Now this platelet will get activated and inside the platelet granules are present. two types of granules, alpha and delta or dense granules. They will secrete the granules in the blood. So all the granules will be, can you see the granules? Appreciate the granules. So all the components present inside the platelet granules, they will be secreted in the blood, in the fluid. This step is known as platelet activation. This step, and they will call more and more platelet here to form the plug, so that the activation take place. So first platelet adhesion take place, then platelet activation take place, and then more and more platelet will come and they will form bond over the platelet, more bonds. So bond between platelet and platelet is known as platelet aggregation. In this diagram you can appreciate the first row is showing platelet adhesion, but the subsequent all rows will show the platelet aggregation. So three steps takes place simultaneously: platelet activation, adhesion, activation and aggregation. So let me describe the three steps one by one. You can see in this diagram platelet adhesion. What is platelet adhesion? Platelet adhesion is the formation of bond of the platelet with the subendothelial tissue. So here platelet form bonds with subendothelial tissue. What are the receptors? Can you appreciate the name of the receptors? On the surface of the platelet there are receptors GP1A2A or GP1B9. GP is glycoprotein, glycoprotein 1A 2A or glycoprotein 1B9. These are the receptors on the surface of the platelet which are forming the bond with the subendothelial tissue. Can you appreciate the bond with the subendothelial tissue? With the help of the intermediate bridge is the von Willebrand factor. So here in this diagram you can appreciate the green color bridge is the von Willebrand factor. So this platelet is showing adhesion. In adhesion there is formation of bond between the platelet and the subendothelial tissue with the help of receptors on the platelet. The name of the receptors is GP1A2A and GP1B9, and it is with the help of a bridge which is known as von Willebrand bridge, that is platelet adhesion. Now platelet activation. This platelet will get activated and secrete granules inside it. Two types of granules are there, alpha granules and dense granules. So see the composition of alpha and dense granules. You can appreciate what is present inside the alpha granules, what is present inside the dense granules. So everything is secreted out, and the granules, the components of the granules, they will call other platelets for help. The last step is platelet aggregation. You can appreciate in this diagram, this platelet is showing adhesion and these two platelets are showing aggregation. What do you mean by aggregation? So adhesion is the formation of bond between the platelet and the subendothelial tissue. Aggregation is the formation of bond between platelet and platelet. So more and more. So first row is formed of bond between the platelet and subendothelial tissue, and subsequent rows of platelet will come one behind the other, one above the other, forming bond between platelet and platelet. This is known as platelet aggregation. For this different receptors are required. The name of the receptors here is GP2B3A. So GP2B3A will be the name of the receptor. So that's it. So these are the two type of receptors present which are responsible for platelet adhesion and aggregation. So primary plug is formed of platelet. Now coming on the secondary plug, the secondary hemostasis. The secondary hemostasis, the primary one is very unstable. You have to stabilize the primary one with the help of clotting factors which is known as secondary hemostasis. So what actually happens at the time of the injury, a cascade of motion set in which causes the activation of all clotting factors one by one. So there are two pathways here, intrinsic pathway and extrinsic pathway. You can understand in intrinsic pathway it is factor number 12 which leads to activation of 11. 11 leads to activation of 9. 9 in presence of 8 leads to activation of 10. 10 in presence of 5 leads to activation of 2 and 2 leads to 1. So factor number 1 is the last factor which get activated here in intrinsic pathway. Let's talk about extrinsic pathway. In extrinsic pathway it is only factor number 7 which directly activates factor number 10. So this is the pathway you can see, and this pathway is known as common, that is 10, 5, 2, 1. Because it is common in intrinsic also, it is common in extrinsic also. If you want to write it separately, you can write it like this. Intrinsic is 12 followed by 11 followed by 9 followed by 8, 10, 5, 2, 1. It is a cascade. You have to learn the sequence. In extrinsic it is 7 directly leading to activation of 10. So if you talk about intrinsic, the sequence is 12 leading to 11, leading to 9, leading to 8, leading to 10, in presence of 5, leading to 2 and leading to activation of 1. And if you talk about extrinsic, it is factor number 7 which directly leads to activation of 10, 5, 2, 1. So ultimately last factor, whether it is intrinsic or whether it is extrinsic, the last factor which is activated here is factor number 1. What is the name of factor number 1? The factor number 1 is fibrinogen. So fibrinogen is the inactive form which will get converted into fibrin. So ultimately either because of intrinsic or because of extrinsic, factor number 1, that is fibrinogen, get converted into fibrin. This fibrin will get deposited over the platelet in primary clot and get it stabilized. Now the clot is known as secondary clot. So in this diagram, you can see the platelets are forming the primary clot. These rows is showing platelet adhesion and subsequent all rows are showing platelet aggregation. Now if you can see here, the fibrin, the yellow color fibrin is there, which is forming a network, a thread-like network, which is stabilizing the primary clot and converting into secondary clot. And in the end, when the healing is completed, the clot will dissolve. It will be reabsorbed with the help of plasminogen. In the blood, plasminogen is present. Plasminogen will get converted into plasmin, and plasmin causes the dissolution of this clot. It will get dissolved. Dissolution of the clot takes place. So what is the summary of the hemostasis? I would like to draw a diagram here. In this diagram, you can see I am drawing a blood vessel. So this is the subendothelial tissue. This is the endothelial lining. You can appreciate the endothelial lining is continuous, and in this portion it is discontinuous. So this is the site of the injury. This is the portion having site of injury. Now from the blood, platelets will come. The first row of the platelet, which is coming and forming a bond here with the subendothelial tissue, this platelet row is showing adhesion. It is formation of bond between the platelet and then the subendothelial tissue. The receptors required for this bond is GP1A2A. So these receptors are responsible for adhesion. Now these all platelets will secrete granules in the blood. So these granules will call more and more and more platelets, alpha granules and delta granules. So more and more platelet will come and form a bond here. So the second row, the third row, the fourth row, the fifth row. So subsequently multiple rows are formed, and these all rows are showing aggregation because they are forming bond between platelet and platelet. I hope you got the difference between adhesion and aggregation. For aggregation, different receptors are required. The name of the receptors here is glycoprotein 2B3A. It is GP2B3A. So for adhesion 1A, 2A, and for aggregation 2B3A. These are the name of the two glycoproteins or receptors responsible for adhesion and aggregation respectively. Ultimately, this clot is primary clot, but it is very unstable. Now in the blood, clotting factor number 1, factor number 2, factor number 3, factor number 4, likewise till 12, all factors are present, but all of them are inactive. Now either by intrinsic pathway or by extrinsic pathway, they all will get activated one by one in the form of a cascade. You know the sequence, and ultimately the last is factor 1 to get activated. This factor 1 is fibrinogen. On activation, it converts into fibrin. Now this fibrin will form a thread-like consistency over the primary clot, and now this primary clot, in which platelet, which is stabilized by fibrin, that is factor number 1, coagulating factor number 1. Now this clot is known as secondary clot, and this one is stable. Now when the healing is completed, here the healing is completed, at that time in the blood plasminogen is present, and it will convert into plasmin at the activation on healing, and it will dissolve the complete clot. So what are the 4 steps? The first step is the vasoconstriction. It is very momentarily, it is transient, the first step. The second step is the primary clot formation. Primary clot is always made up of platelet. You can appreciate platelet adhesion, activation, aggregation. It is platelet. The secondary clot is made up of coagulation factors. So the last factor to get activated is factor number 1. It is known as fibrin, and fibrin will stabilize the platelet. Now it is secondary clot, either by intrinsic pathway or extrinsic and common pathway. And in the end, plasmin will come, and tissue plasminogen, plasmin will dissolve the clot. That is clot resolution. So these are the 4 steps of hemostasis. In hemostasis, there are 4 steps: vasoconstriction, primary clot formation made up of platelet, secondary clot formation made up of coagulation factors, that is stabilization of the primary clot with the help of fibrin, factor number 1, and last is clot resolution, which is done by plasmin. So these are the 4 steps of hemostasis. Now coming on thrombosis. So what is thrombosis? Thrombosis, the same mechanism as that of hemostasis, which we have discussed, the same 4 steps. But the only difference, thrombosis occurs without injury. The blood vessel is intact, no bleeding is there. Still inside the lumen of the blood vessel, a clot is formed, that is known as thrombus. So let me draw a blood vessel to explain you the thrombosis. This is a blood vessel. Appreciate the endothelial lining is continuous everywhere. There is no site of injury. There is no site of injury. Still inside the lumen of the blood, the platelet are coming and forming here adhesion. They are doing adhesion, activation, aggregation, and after that the clotting factors will get activated. So in the end, factor number 1 will be activated, and it will stabilize the primary clot. So this is a clot that is primary as well as secondary. The primary clot is the platelet component inside the clot. The secondary clot is the fibrin component inside the clot, that is the coagulation factor. This clot is formed in the blood vessel, in the lumen of the blood without injury. So what is the harm? What is the harm? It is obstructing the blood flow. So it is obstructing the blood flow, so the organ will have ischemia. So that is pathological, it is not physiological, and the disease is known as thrombosis. So what is thrombosis? It is formation of blood clot inside the lumen of the blood or the heart, right, obstructing the blood flow, and it is pathological, it is without injury, it is known as thrombus, and the mechanism is known as thrombosis. You can appreciate in this diagram, you can see this is thrombosis. Inside an intact blood vessel, the thrombus is formed. So what is the difference between hemostasis and thrombosis? Hemostasis and thrombosis, both of them are same things. The mechanism is exactly same, in which a clot is formed, the primary clot which is stabilized by the secondary clot. So primary and secondary clot is formed in both of them, but only difference, hemostasis occurs after injury and thrombosis occurs without injury. So hemostasis occurs with injury to the CVS and thrombosis occurs without injury to the CVS. So that is the only difference between them, hemostasis and thrombosis. You can see in this diagram, these are the RBCs, you can appreciate, these are the platelets, you can appreciate, and over it a thread like material you can see is the fibrin. So it is the primary clot as well as secondary clot inside a intact blood vessel who is uninjured. So that is thrombosis. Here also in this diagram you can appreciate a thrombus is formed in an intact blood vessel. Still the thrombus is attached with the wall of the blood vessel, it is known as thrombus. Once it gets detached and move freely in the lumen of the blood, it is known as embolus. So that is the thrombosis and embolism. Now, coming on the pathophysiology, we have understood what is thrombosis. Coming on the pathophysiology of thrombosis, why thrombus is formed? So it is known as Virchow triad. Virchow is a person who has explained the mechanism, the pathophysiology, the etiopathogenesis of thrombus formation. So there are three reasons because of which thrombus can be formed even in an uninjured blood vessel. The first reason is endothelial injury. The second reason is the altered blood flow, and the third reason is hypercoagulability of the blood, because of which any of them the thrombus can be formed. It is known as Virchow triad. It is a very important question for the university exams. So what is Virchow triad? Virchow triad contains three things. Virchow triad explains the pathophysiology of the thrombus formation. It explains three things. Thrombus can be formed because of endothelial injury, because of abnormal blood flow, or because of hypercoagulability. We will be discussing them one by one. So either endothelial injury or abnormal blood flow means stasis or turbulence of the blood flow, or hypercoagulability. These three things lead to thrombosis, and it is known as Virchow triad. This is thrombosis and it leads to Virchow triad. So let me continue. Let me explain you the three reasons one by one. Let me start the first one, endothelial injury. Endothelial injury. In endothelial injury, in intact endothelium, if the lining is smooth, there is no thrombus formation. But if endothelial injury is there, only endothelium is injured, subendothelial tissue is intact, there is no bleeding, so it can lead to thrombus formation. So inside the lumen of the blood, we have prothrombotic material, that is thromboplastin, von Willebrand factor, platelet activating factor. They are prothrombotic. So they increases the propensity of formation of thrombus. There are certain antithrombotic materials, that is heparin-like substance, thrombomodulin, tissue plasminogen activator, inhibitors of platelet aggregation. So these are antithrombotic, they inhibit the thrombus formation. Normally there is a balance in prothrombotic and antithrombotic, they are equal and opposite in a blood vessel. But whenever endothelial injury is there, due to any reason the endothelium is injured with some toxin, with some agent, so at that time prothrombotic material increases as compared to antithrombotic material and imbalance occur. That can lead to thrombus formation. This is the mechanism behind it, behind the endothelial injury. Now coming on altered blood flow. Blood flow is normal blood flow, is axial blood flow. What do you mean by axial blood flow? In the axial blood flow, according to Bernoulli's theorem, whenever fluid travels in a pipe, the heavier thing travels at the center and the lighter things travels at the periphery. So most heavy is the WBC which travels at the center, and periphery the WBC. Surrounding the WBC there are RBC and platelet, but the plasma is the lightest. So plasma is at the extremity. So actually a layer of plasma separates the platelet from the endothelium. You can see in this diagram the platelets, these are the platelets, they are not coming in direct contact with the endothelium because of a layer of plasma. But if blood is stasis is there in the blood, either stasis or turbulence. So in stasis or turbulence, the axial blood flow is gone and it get converted into reverse axial blood flow, in which the platelet directly come in contact with the endothelium and they will show adhesion, activation and aggregation. So that can be the reason in altered blood flow. So normally blood flow is axial, in which central is the WBC, followed by RBC and followed by platelet, and most periphery is the plasma. So basically platelets are separated from endothelium by a layer of plasma. But in stasis and in turbulence, in both of them, axial blood flow get converted into reverse axial blood flow, in which the platelet will come directly in contact with the endothelium. So there are high chances of thrombus formation. Platelet will show adhesion, aggregation and activation and aggregation. The last reason is the hypercoagulability of blood. In the blood, there are two types of hypercoagulability, hereditary or acquired. In the hereditary, there can be congenital hereditary deficiency of antithrombin 3, protein C, protein S. These all are antithrombotic material, or mutation of factor 5, or defects in fibrinolysis. So all these are hereditary, inherited factors which can lead to thrombosis. In the acquired one, there can be prolonged bed rest due to surgery, due to old age, due to post-delivery, postpartum, during pregnancy. Any prolonged bed rest can lead to propensity of thrombus formation. That is the important one in acquired. Now there are certain cancers in which thrombus formation take place. For example, pancreas most commonly, lung, and others may breast, stomach, prostate. These are the cancers in which thrombus formation is very common. So coexistence of the thrombus and malignancy is a syndrome. It is known as Trousseau's syndrome, that is known as migratory thrombophlebitis. Very important question for the MBBS university exams. What is Trousseau syndrome? What is migratory thrombophlebitis? So it is cancer or malignancy coexistence with the thrombosis. So the combination is known as migratory thrombophlebitis or Trousseau syndrome. Now coming on the types of the thrombi. What are the types of the thrombi? There are three types of the thrombi. If the thrombi is formed in the heart, it is known as cardiac thrombi. If they are formed in artery, they are known as arterial. If they are formed in the vein, these are known as venous. So three types of thrombi are present. Grossly, arterial and venous. Okay. In the heart, grossly, if you talk about the thrombus in the heart they will be deposited on the heart walls and they are known as vegetations. So thrombus in the heart are known as vegetations. In the artery and in the vein, the arterial one are white in color and the venous one are red in color. What is the reason? In the arterial one, because there is more platelet and less fibrin, and in the venous one there is less platelet and more fibrin and more RBC. That's why venous one are red. See the diagram. In this diagram, you can see this one is arterial one, this one is venous one. In the arterial one, you can appreciate the platelets are more. The platelets are more, but fibrin is less. So that is giving white color. So it is known as white clot. That is white thrombus, the arterial one. The venous one, you can appreciate the fibrin is more. The platelet is less. So fibrin is more, platelet is less, and RBC is also more. That's why it is known as red clot. So arterial clot basically is white clot because of more platelet, less fibrin, less RBC, and venous clot is known as red clot because of more RBC, more fibrin and less platelet. So you can see the gross difference, you can see the composition, the same information is given in this diagram also. You can see in this diagram, this is arterial thrombus, this is venous thrombus. The arterial thrombus appreciate more platelet. These all are platelet, that's why it is white in color, less fibrin. And in the venous one, appreciate more RBC. Because of the RBC, it is red in color. So that is the gross difference. So arterial thrombus, as I have told you, these are white in color, these are mural, and they have lines of Zahan. What do you mean by lines of Zahan? Lines of Zahan are the alternate light, dark bands. So can you see the arterial thrombus, as I have told you, the platelet are more, which is creating light band, and the fibrin is less, which is creating dark band. So alternate, can you appreciate here in this diagram? This is light, this is dark. Again this is light, again this is dark, again this is, so alternate light dark bands are known as lines of Zahan, and it is a feature of arterial thrombus. Lines of Zahan are absent in venous thrombus. So that is the thing. You can appreciate this is light dark. These are lines of Zahan. Lines of Zahan are feature of arterial thrombus, not venous thrombus. That is lines of Zahan. Coming on venous thrombus. So venous thrombus are red in color and they are occlusive, and here lines of Zahan are absent. So what do you mean by occlusive and mural? So I would like to draw a diagram. This is the artery and this is a vein. I would like to draw thrombus in both of them. So this is a thrombus inside the artery, this is a thrombus inside the vein. In artery, it is partially occluding the lumen of the artery, but in vein, it is complete occlusive. It will complete occlude the lumen. So arterial one are mural. Let me write here. The arterial one are mural means partial obstruction, but venous one are occlusive. That is, they are complete complete obstruction. So arterial one, venous one, this is one of the difference. Now the differences between arterial thrombus and venous thrombus is ultra important for university exam. So on what basis you have to decide? So arterial thrombus mainly formed because of endothelial injury from the virtual triad, but venous thrombus are formed due to altered blood flow or stasis of the blood flow. So there are three things in the virtual triad: endothelial injury, stasis of blood flow, and hypercoagulability of the blood. So endothelial injury basically give rise to arterial thrombus, and stasis of blood flow basically give rise to venous thrombus. Blood flow in arterial thrombus, it is active blood flow. In venous thrombus, it is sluggish blood flow. Most common arteries are coronary, cerebral and femoral arteries. Most common veins are superficial and deep leg veins and ovarian veins and periuterine veins. Propagation. For explaining you propagation, I would like to draw a diagram. I would like to draw a artery and I would like to draw a vein. This is the vein. This is the blood flow, direction of blood flow in each of them. Let me draw a thrombus. This is a thrombus in artery. This is a thrombus in vein. So diagram is crystal clear. Arterial thrombus propagate in retrograde direction, that is direction opposite to that of blood flow. On the contrary, venous thrombus grow in the direction of the blood flow, that is antegrade. So can I say arterial thrombus grow retrograde and venous thrombus grow antegrade? See the direction of their growth. So crystal clear diagram. This is arterial thrombus, this is venous thrombus. You can understand the arterial one is growing opposite to that of blood flow. On the contrary, venous one is growing in the same direction as that of blood flow. So it is a rule that arterial thrombus grow in opposite direction as that of blood flow, retrograde propagation, and venous will grow in the same direction as that of blood flow, that is known as antegrade propagation. So you can understand the propagation. The propagation is retrograde in arterial and antegrade in the venous one. In the microscopy, as I have told you, lines of Zahan. The lines of Zahan are present in arterial thrombus, but they are absent in venous thrombus. Arterial one is partially, incompletely occluding the lumen. Venous one completely occlude the lumen. Arterial one will lead to infarction and ischemia of the organ. Venous one will lead to embolism and edema of the organ. So you can understand like that. Now imagine this is the organ. So the artery is supplying pure blood to the organ and vein is taking impure blood out of the organ. This is a organ. Now if there is a thrombus in the artery, so blood flow here is compromised. So the organ will have ischemia and infarction because there is a thrombus in the artery. But if the artery is clear and there is a thrombus in vein, so impure blood cannot leave the organ. So it will have edema. So arterial thrombus leads to ischemia infarction, venous thrombus leads to edema. So these are the important points you must learn between arterial thrombus and venous thrombus, very important for exam. So arterial thrombus are formed because of endothelial injury, the most common reason. Venous thrombus is formed because of stasis of the blood flow. Arterial thrombus formed in active blood flow, the venous one formed in sluggish blood flow. In arterial one, the lines of Zahan are present. In venous one, the lines of Zahan are absent. Arterial one are white in color because of more platelet, more fibrin, less fibrin, less RBC. Venous one are red in color because of less platelet, more fibrin, more RBC. So that is the color difference. Arterial one propagate in opposite direction that of blood flow, retrograde propagation. Venous one propagate in the same direction as that of blood flow, that is antegrade propagation. So we have understood these differences. Arterial one will lead to infarction and ischemia of the organ. Venous one will lead to edema of the organ. So these are the consequences. Based on these points, you must draw the diagram and you must understand the differences between arterial and venous thrombus. So what is the fate of the thrombus? The next thing is the fate. So either with time the thrombus decrease in size, it is known as resolution, or with time it is fixed with the size. It is neither decreasing nor increasing, it is calcified and got fixed. It is known as organization. With time it can increase in size, it is known as propagation, and with time it can detach from its site of origin and go to some other point with the flow of the blood. It is known as embolism. So there are four fates: resolution, that is decrease in size; organization, that is fixed size; propagation, that is increased in size; and embolism means detachment of the thrombus and converting into emboli. So these are the four fates of the thrombus. So what is the summary of this session? What we have learned in this session? In this session we learned four things. What is thrombus? What is the pathogenesis of thrombosis? What are the types of thrombosis? And what is the fate of thrombosis? Let's revise. What is thrombosis? Thrombosis is formation of a clot, the primary and secondary, that is platelet clot and coagulation factor clot, in an uninjured blood vessel, in an uninjured circulatory system. there is no injury. If it occurs after injury, it is hemostasis, that is physiological. But without injury, it is pathological, it is a disease, it is known as thrombosis. So that is the meaning of the thrombosis, the definition. Coming on pathophysiology. Pathophysiology, there are three things. The three things is known as virtual triad, that is endothelial injury, stasis of the blood flow and hypercoagulability, that is virtual triad. Now coming on the types, there are two types of thrombus, arterial thrombus and venous. The third one are the cardiac one, which are present in heart and causes the vegetations in the heart. The arterial one differences from the arterial one and venous one, the differences between them we have already understood. Arterial one basically formed because of endothelial injury, venous one are because of stasis of blood flow. Arterial one formed in active blood flow, the venous one in sluggish blood flow. Arterial one examples are coronary, cerebral and femoral artery. Venous one examples are superficial and deep veins of the leg. Propagation, arterial one propagate in opposite direction, retrograde direction. Venous one propagate in the same direction, antegrade direction. Lines of Zahan are absent in arterial one, lines of Zahan are present in venous one, the alternate light dark band. Arterial one are incomplete occlusive, the venous one are complete occlusive. Arterial one leads to ischemia and infarction, the venous one leads to edema embolism. We have understood the differences between them, diagram between them and the mechanism in each of the point. Why the difference is there? You can see the diagram, the arterial one are white in color, the venous one are red in color. So that is the composition. The last thing is the fate of thrombus. So either thrombus with time decrease in size, that is known as resolution, or it is fixed in size. With time it is known as organization, it increases in size, it is known as propagation, or it detached from its point of origin, it is known as embolism. That's all about thrombosis.